Well, I just finished teaching karate class. This is actually my last class before my hip replacement tomorrow. Going into the hospital tomorrow to get a left total hip replacement. This is something I've been thinking about for 2 or 3 years now. I've had a couple of cortisone shots. I had an RPR injection, which is plasma-rich platelets. PRP injection, plasma-rich platelets, where they take the blood out of your system, they put it in a centrifuge, and then inject the platelets back into the joint. That was pretty good for a few months, but I've decided I'm going to go ahead and do it now. Probably because of 50 years of martial arts, hundreds of thousands of round kicks, crescent kicks, turning back kicks. I'm sure my age has something to do with it too. I'm 67. Well, what they're going to do is they're going to do an anterior approach where they come in the front of the hip to do the hip replacement. There's also a posterior approach where they come into the back. The anterior approach, I've researched it, and you can Google it too. The recovery is a little bit easier, so that's what I've decided to do. What I'm going to do is I'm going to keep you guys up on the journey. We'll do it tomorrow. I'll go into PT, and I'll let you know how the recovery goes and when I'm back doing those roundhouse kicks once again. Okay, it's been 2 days since my surgery. Pardon my sore throat. They actually put a breathing tube down my throat during the surgery, which made it quite sore, and that's why I'm kind of hoarse right now. I actually spent 2 nights in the hospital because I didn't react well to the combination of anesthesia and pain medication. Yeah, they kind of threw me for a curve. I was throwing up and feeling lightheaded, and you don't want to have to experience a catheter, believe me. Also, the surgery was later in the afternoon. It was 1 o'clock in the afternoon. The surgeon said it was his 4th one of the day. So I wasn't able to get back in time to do any PT that day. I had to wait until the next day, when I did do a few exercises, which were hard to do and a little painful, plus some walking up and down the hall in the hospital. Anyway, I'm back home now. The home health nurse will come by tomorrow for an evaluation and to set up an exercise schedule. By the way, Medicare pays for 2 weeks of home nurse visits, so that's pretty nice. As I continue on my hopefully fairly short recovery period, I'll keep you posted on my progress after my total hip replacement.